Hi, ladies and gentlemen. My name is Jane Ejiofor with Grand Canyon University. I'm a master's student in the Department of Mental Health and Wellness. Today, we will be discussing a little bit about conflict um, decisions and conflict of interest and decision making. Before we get to that, I would love to have you introduce yourselves. Let me start with you. What is your name?
Mr. A.
I'm glad to have you here, Mr. A. What is your name?
Hi, my name is Miss A.
Miss A, it's good to have you as well. I've already told you my name, and today's discussion will be over conflict of interest, decision making, and in health and wellness. Okay? And as we go along, please feel free to stop me with any questions that you may have, or and I'll be glad to have some discussions privately if that's what you would also prefer. Um, Let us start with examples of conflict of interest. What is conflict of interest? Conflict of interest is a situation that may arise in mental health where your beliefs kind of contradict the belief of the organization or the client or the organization you belong to. So when a professional, personal, it can be personal, it can be financial, it can be relational, different things that can actually affect the way you care for your patient or for your client. One of the examples of a conflict of interest might be dual relationship. Dual relationship occurs when you and your client has a different relationship outside the client professional relationship. This occurs when you can when you're maybe you are friends on social media, or you guys attend the same meeting or parties, and the relationship is tended from the client professional relationship in counseling to something else that's outside there. And this can affect the way the professional acts or objectivity and the way they counsel the client at that time. So this can also kind of impair therapeutic judgment in many ways. So this is one of the conflicts that the professional has to guard against and be conscious of. Now, according to to resolve this kind of conflict, you have to be certain to be aware of the guiding ethics of the association, if it's American Counseling Association or the American Psychology Association or different organizations that you belong to. You have to be sure to also know the organization, the ethics that are bound in the organization you work for. Another one is financial incentive. That can also be a conflict of interest where the professional is referring the client to another area for treatment in the interest of getting some money given to or paid to him in return for that referral. This can also impair the needs of the client in the sense that the professional is doing it in response or as a result of the benefits he will get from it. So those are the two conflicts of interest. Now, as far as my personal values, I would love to talk to you about this in a way that it can be clear to everybody. We have our personal biases, every one of us. But when it starts interfering with the way we care for our client, that's when it becomes a problem. I'll give you one of these scenarios. Some people with different cultural beliefs, some people don't believe in arranged marriages. There are some cultures that, some people don't eat pork because of their religion. So pork meat. So those things can affect some people. It can be a bias to some people when they get in contact with those the same that has this different beliefs on those. For instance, some people don't like to take care of LGBT group of people, but that doesn't. No matter how you look at it, that's their personal belief. But for the professional, you have to make sure that you still respect their dignity and personal beliefs. The client may be judged, misunderstood based on those beliefs, but it is always the professional's requirement to be self-aware and be sure to be, practice the standard and code of ethics of their profession and not judge individuals based on their personal beliefs. One ethical principle, or some of the ethical principles in mental health and wellness, some of the organizations and their ethics, the American Counseling Association, ACA, they believe in autonomy, non-maleficence, beneficence, justice, fidelity, and veracity. That's American Counseling Association. The American Psychological Association, respect of people for people's rights and dignity, integrity, justice, as well as beneficence, non-maleficence, and fidelity and responsibility. The National Association of Social Workers, they believe in social service, social justice, dignity and worth of the person, service, the importance of human relations, integrity, and competence. These codes emphasize the importance of protecting client welfare and maintaining professional boundaries. Ethical dilemmas and navigations. One of the dilemmas that I've noticed in counseling and in studying and mental health and wellness is that of confidentiality and duty to warn. As we all know, HIPAA is a regulation that is the law of the land. But then there's also the confidentiality of making sure that, the client's information are kept confidential and are respected, that you don't give out information without the express permission of the client. But then there's also the duty to warn when, in situations like suicide and when the life of others or the client is at risk. So those are the dilemmas that kind of brings it to life, where you really have to think about the situation clearly and be well aware of it to be able to say what exactly should happen in that situation. Should I keep it secret? Should I warn others? But absolutely, if the life of others are at risk, then you have the duty to warn in that situation. But always remember that confidentiality is a regulation, is a law of the land, and the patient's information must be kept confidential. To navigate this situation, the counselor must choose between maintaining confidentiality and the ethical legal duty to protect a third party. Like I said, if it's a case where others' health and life is at risk, or situation where suicide is involved, or suicide ideation even, there is always, you are required to report that. But it's a line that the professional must be very aware of and work on it as clearly as possible. Follow the rules, follow the ACA Code of Conduct for confidentiality, follow the HIPAA regulations, consult your supervisors if need arises. That is always a good way to take it. If you're not sure what to do, go to your supervisors, talk to your peers, talk to people that you work with, especially if they are connected in the care of that patient. That way you can make a concrete decision on the best thing to do. Another thing is the cultural competence versus client autonomy. We always believe that the client has the right to make their own personal decisions. But if there's a situation where, the professional is not culturally aware or well informed of the client's culture, it's always, the best thing is always to consult with your supervisor about the practices of the people so that you don't get judgmental or have a situation where the client's well-being is being hindered or counseling is being hindered because of the beliefs that differ in that situation. So it's always better to apply cultural humility rather than impose one's culture or one's ideas on the client. Collaborate with your client, integrate cultural values. It's always best to, seek advice from people that really are familiar with that culture. And the National Association for Social Workers also emphasized, it talked a little bit about cultural competence and respecting diversity while ensuring ethical practice. So those are some of the things that I wanted to talk to you about today. Do you have any questions?
No.
Okay, if no questions, I think I covered most of it, but I'll be here for a little bit in case you have any questions. Thank you for your time. Thank you for being here. I appreciate your presence. Thank you.
Thank you.